We're now going to discuss an insurance that gets very confused with Medicare, and that's Medicaid. See, many individuals confuse the term Medicare and Medicaid. Both have very similar names, so it's very easy to see how that can be confusing. Again, remember, Medicare just doesn't make any sense sometimes. Both programs are sponsored by the U.S. government and designed to cover health care costs for Americans, but they are actually two separate programs. Here's the difference. Eligibility for Medicaid assistance is based primarily on financial need. Eligibility for Medicare, on the other hand, has nothing to do with an income actual level. So Medicaid is actually the largest insurance coverage in the United States. Medicaid is the single largest health insurance coverage in the United States, currently covering over 72 million Americans. Of that number, over 7 million are low-income seniors actually on Medicare. Medicaid is extended to those individuals that are at or below the 133% of the federal poverty level. Whenever the news talks about expanding Medicaid, they're talking about raising or extending the poverty percentage guideline. Medicaid is for low-income assistance, and it's the last resort for health insurance for those that do not have any other means for their health insurance due to actual income. So an individual that's turning 65 that has Medicaid will typically be automatically enrolled into Medicare Part A and B during their 7-month initial enrollment period IEP because they're receiving Social Security benefits. The individual will not lose Medicaid eligibility because they're turning 65 and actually eligible for Medicare. See, once that individual has Medicare and Medicaid, what will happen is they'll automatically qualify for extra help under Part D, and Medicare will cover their prescriptions. If the income level is still below the limits, the individual may also qualify for help paying the standard monthly Part B premium of $148.50 in 2021 from their state through a Medicare savings program, which we'll discuss a little bit later in another video. Once that individual has both Medicare and Medicaid, they will commonly be referred to as dual eligible. When an individual has Medicare and Medicaid and they're dual eligible, they'll qualify for what's called some special needs plans. See, once that individual is eligible for Medicare, the state Medicaid program will now work with Medicare to get them all the help they qualify through one of the 4 Medicare savings programs. Once that individual is dual eligible, which means they have Medicare and Medicaid, there are some really good Medicare Advantage plans that are designed to specifically detect, treat, and prevent a chronic condition that they may be diagnosed with. It is estimated that almost 1/3 of dual eligibles are enrolled in some sort of special needs plan through a Medicare Advantage program. So in conclusion, when it comes down to Medicaid, an individual turning 65 that has Medicaid will typically be automatically enrolled into Medicare Part A and B during their 7-month initial enrollment period IEP because they're already receiving Social Security benefits. That individual that has Medicare and Medicaid will be referred to as dual eligible. The individual will qualify for a special needs plan through a Medicare Advantage program. This individual should speak to an insurance agent to discuss whether a special needs plan through a Medicare Advantage program would best fit their needs. If you're in that situation, please give us a call here at Healthcare Student Direct so that we can look at the special needs plans in your area that would best benefit you.